Good evening and welcome to tonight's webinar, kindly sponsored by Feline Friends. Tonight's subject is Flabby Felines and Cuddly Kitties. We're in for a real treat today. Our presenter is Samantha Taylor. Sam graduated from the Royal College in 2002 and completed internships in private referral practice before starting a Feline Advisory Bureau residency at Bristol University. She was awarded the RCVS certificate in small animal medicine in 2006 and the European Diploma in Veterinary Internal Medicine in 2009. In 2011, she became an RCVS recognised specialist in feline medicine, as well as working in clinical referral practice at Lumbury Park Veterinary Specialists. She works for International Cat Care, specifically involved in distance learning and nursing education, and edits the monthly journal Feline Focus. So I think you'll all agree we've got a very esteemed presenter with us tonight. As always, it'd be great to hear from you. So throughout the presentation, if you do have any questions for Samantha, please do put them in the Q&A box, which you will find at the bottom of the page. We're also joined tonight by my colleague Peter, who's here to help you with any technical issues. So once again, if you've got any technical difficulties, please do put them in the chat box and we will come to you and resolve those issues for you. So without further ado, I'd like to hand over to Samantha and I will speak to you shortly. Thanks a lot.
Oh, thank you very much for that introduction and good evening to anyone who's listening. Thank you very much to Feline Friends for asking me to speak on this topic, which is one that's quite close to my heart and my house. I will make some confessions later about the size of my own cat, but I will say it's not quite as big as this cat. And we have a few pictures of some very, very obese cats in this talk, but I don't want you to think that all cats that we need to deal with their obesity are that obese. Some weight gain year on year, which I'll go through, really does make a difference to a cat's health. So let's get started talking about these flabby kittens. Oh, or I would. There we go. So there is an increasing problem with obesity, and I apologize for this picture, but it does emphasize perhaps the point that human obesity is growing. We read about it in the news all the time. But the fact is that feline obesity is also growing. So the equivalent is quite obvious in humans and certainly obvious in a cat of this size. But how we can all take a look at the cats in our homes and see whether they are above the weight they should be. So what is obesity? What's the definition of obesity? And really we define it as, technically an accumulation of excessive adipose tissue. And adipose tissue is fat tissue. So it's basically fat that you don't need and that the cat doesn't need. And we tend to say when they're 20% over their ideal body weight, then they're obese. But there are a lot of overweight cats that are between 10 and 19% above their ideal weight. And this leaves us with this kind of figure, which is always difficult to define, but around 20 to 50% of cats in the UK being overweight or obese. That's probably comparable or perhaps even a bit less to the USA. And we'll talk about why this might be in a moment. But I wanted to just make this point. If you have, and I lecture a lot of vets on obesity as well, and a small weight gain in a young cat might be not noticed and not be particularly exciting. But what happens is that again, this small amount, this 200 grams year on year, and you can see by the time they're, it's still a young cat at 4.5, they can be obese. And what we need to try and work on is avoiding these adults or mature cats that are presenting to the veterinary clinic with problems related to obesity. So it's this little weight gain, this little slow bit like ourselves, not a sudden gain in a lot of weight, but just a very subtle year on year chronic weight gain that can make a massive difference to our cats. So why is this? Why is obesity becoming more common? And there are a few slides here I just want to go through, and I think it probably will make sense to you. And we have to go back to the origin of cats and remember where they came from. So cats are these gorgeous little solo hunters. They originate from the African wildcat, where they would have territories of miles and miles. They would tend to live on their own, hunt for their food, and so they would have a much more outdoors, much more active lifestyle. And in fact, even if you go back to 20 years ago, 30 years ago, cats were generally not kept as pampered pets. They were kept to do a job. So they were kept to catch rodents, or, they came into the house, but they went out on the farm. again, you can see that lifestyle, a lot of miles under their feet, really. A lot of cats were not neutered, and we know that neutering tends to encourage wandering and therefore traveling further away, and all of these things increasing activity. And what we really have today is our little feline couch potato, which is quite removed from that little African wildcat. And, you know, they're going to take that opportunity to sleep, and they've got readily available food. Why would they move very far? And so their waistlines expand. So that change in lifestyle is significant. There's also been a change in the type of food that they're fed. So again, 10, 20 years ago, the cats were fending for themselves in the majority of cases. And they would be catching between 10 and 20 mice in small meals, you know, regular small meals a day. And that is a far cry from a bowl of kibble that requires a movement of a metre from their bed in order to reach their calorie requirements, instead of patience and hunting and travelling. So that's a big difference in our modern cat lifestyles. There's also some differences, really, if you think about it, in the way the cats are fed. So again, when they were hunting, when they had to work for their food and they were outdoors, compared to having ad lib food. So often a problem with obese cats is them being fed ad lib. So having food available on hand, ready, you know, they can get it at any time. As I say, they don't have to go very far. They don't have to expend any energy in order to meet and exceed their calorie requirements. So, you know, this modern house cat is quite far removed from, and this is a house, you know, sort of pet cat as well, but to illustrate the point of a cat who was outdoors and hunting for their food. So I think those changes explain, you know, enough why we've got fat cats today. These other factors I wanted to mention, I've touched on ad lib feeding. So by ad lib feeding, I mean a full food bowl there available, you know, all day, and the cat to visit when they feel like it. And it's very, very easy for them to, particularly with dry food as well, to exceed their calorie intake by doing this. Neutering certainly has an effect. Now, please don't think I'm not encouraging neutering. I'm, you know, a strong advocate of neutering. It's, you know, it has so many health benefits for our cats. But I will concede that it has a double whammy effect on their calorie requirements. So they need less calories, and they are less likely to wander to look for a mate, and therefore they use up less calories. So there is a physiological change in their bodies after neutering that means they need less calories. And that's something we as owners and vets need to be aware of. And certainly veterinary clinics should be, you know, encouraging attention to this after neutering. As I said, that slow, small weight gain at year on year often starts at neutering. Owner lifestyle is another issue. People are busier, people work. It's convenient to put a bowl of food down and let the cat eat as and when it wants to. So that owner lifestyle does play a role as well. They're not around as much. They may not be available to play with the cat as much. And the cat's playing a sort of a different role in their life as well. And if you think about the relationship that some people have with their cats, and feeding is quite important sometimes to that relationship as well. So there's a complex sort of interaction there. Another one I want to mention is misinterpretation, long word, of cat behaviour. What that means when the cat is meowing for attention, and the cat approaches the owner and meows or lifts their tail up, you know, has a very friendly, affiliative behaviour, is that rewarded with food? If it's rewarded with food a couple of times, oh, you must be hungry, would you like a treat? I'm as guilty as anyone of this. We reinforce this behaviour where the cat seeks food from us, but perhaps they just wanted a stroke. And my colleague Alex German, who does a lot of research on feline obesity, one of his big tips is, if the cat comes up and asking for food, clients find this quite distressing and they want to feed their cat, instead get the brush out. And then two things will happen. They're either a cat that likes being brushed, and you have a nice interaction with the cat by brushing them. And if they hate being brushed, then they will go away and stop asking you for food, which I thought was quite a nice solution to that. So what we're saying is that, you know, not every time that the cat seeks interaction with the human do they need to be fed. And it's very quick to make a behaviour, you know, from that. And another aspect is anxiety, and anxiety is something that unfortunately our pet cats do suffer from, and we see a lot of diseases related to that. And it's possible that some of these cats will overeat due to anxiety. I mentioned the origin of cats as being these little single solitary hunters. They don't like to live in groups, although there is some change in that if you look in feral colonies that they will live in groups. So this, anxiety can stem from being in a multi-cat household. Now, many cats adjust very well to being in a multi-cat household, but not every cat. And so that can be a cause of anxiety, and it can result in overeating, essentially. It's not necessarily competition for food, or that can be an issue. It's a little bit like ourselves, prone to reach for the chocolate in an anxious situation, or perhaps I'm just speaking for myself. But I do think that this overeating is potentially an issue related to stress and anxiety. So why is obesity a problem? Why is it an issue? And it's an issue because it causes the cats just like it does humans. And cats are very like people in this situation. Dogs, slightly less so, but cats develop type 2 diabetes. And in fact, obese cats are 4 times as likely to develop diabetes. And this is the same type 2 diabetes as we see in humans. They do often become insulin dependent. And that I think is quite a stark, quite a shocking figure, really, that just weight loss could change the outcome for these cats. And in fact, diabetic cats, when they lose weight, they can go into remission. So we can actually cure their diabetes, which is, absolutely fabulous. So we can cure their diabetes by simply getting them into a good body condition, which I think, you'd agree is fantastic. The other things we see are arthritis. Now, I don't think obesity causes arthritis, but I think it certainly exacerbates arthritis. And so arthritis is very common in cats. Sort of up to 90% of cats over about 14 years old on radiographs probably have some evidence of osteoarthritis. This is a joint here. It should be very smooth surfaced, and what you can see is all this excessive bone rubbing on bone, very painful joint. And you can understand that loading that joint with extra weight is not going to be too much fun for the cat. So, that is an issue. Other problems, constipation is definitely one, and I see chronic constipated cats in my clinic. And the other one is this condition, FLUTD. So you're probably wondering, you may be aware what that stands for, feline lower urinary tract disease. And what I'm talking about is cystitis, really, in the main. So amongst some other urinary issues, but feline idiopathic cystitis is a very frustrating condition, tending to affect young to middle-aged cats. And in males can be very, very serious because they can present as a blocked cat where they can't urinate. And we know from multiple studies that risk factors for developing these type of urinary conditions are being overweight and inactive, which obviously chicken and egg, which one came first? So we will often advise weight loss in those cases. We see some dermatological problems. Literally, some cats are so fat they can't groom properly, and they can develop some real issues as a result of that. They're at increased anaesthetic risk. And the connection with cardiovascular problems we obviously understand in humans. The metabolism of cat is different, so we don't get the same classic heart disease and risk of heart attack type problems. But it's reasonable to think there may be a connection, and it's putting a strain on their cardiovascular system, certainly. So these, are significant health problems, and what we want to avoid these. We don't want to get to this point. By the time we get to this point with these obese cats with these diseases, we've got to work really hard to get on top of them. So can we avoid getting to that point in the first place? Another thing is recognition of obesity, and this is again something I talk to vets and nurses about. So as owners, we often underestimate our cat's weight, and I confess to being as guilty as this as the next person. And my cat had surgery a couple of weeks ago. I took her in and I thought, oh my gosh, she is a kilo heavier than I would have thought. And so that's why, as owners, we need to have our eyes open, but I also tell our vets and vet nurses that they need to weigh cats at every visit. There's no excuse for the cat visiting the vets and not being weighed. And for you as owners, if you're in that vet clinic and they are having a vaccination or whatever, you say, have you weighed him? I'd like him to be weighed. This is so important to monitor this, particularly this post-neutering weight gain. And any cat that comes in with one of the health problems that I've mentioned should have a weight and a body condition score recorded. So it's about opening our eyes, really, and that doesn't just mean owners, it does mean vets and nurses. I still get referred a lot of cases. I work in second opinion practice. I get referred lots of cases that have no weights recorded on them. And I think these cats have been in that clinic. Why has that opportunity not been taken? Conversely, also, I want to know if they're losing weight, if cats are losing weight, because that can be a clear sign of ill health. The other thing that's quite useful is body condition score measurement, because as you can imagine, a Singapura is not going to weigh the same as a Maine Coon. So comparing those weights, although we don't have quite the extremes that we have in dogs with a teacup Yorkie and a Great Dane, there are still some differences of what is normal for a cat. And we talk about body condition score measurement. And this is a practice that you can see in this picture here of essentially sort of palpating the amount of fat over the spine, over the ribs, and some of the systems use taking measurements as well. And this should also be quite routine when a patient is being assessed in the clinic, but it's something that you can look at home. And there are many, all the food companies essentially produce one. They tend to be on a 9-point or a 5-point score. And you can see various sort of criteria, basically. So, ribs visible, obviously, when they're very thin. And when they're very obese, you've got this, enormous fat deposits. And you can hardly, you're slightly overweight level, you can hardly palpate the ribs and the spine. So that can be quite useful as well, and take out the factor of sort of breed and other things. Okay, so we've recognised that our cat is overweight. As I said, I would prefer to prevent it, but if we've got to that situation, then how are we going to manage it? And the first thing I'd say is that that's not something that is very easy to do at home as an owner. I think that's very challenging to do in a home, particularly if you're busy, you've probably got children, you've got more than one cat. All of these things are very challenging. And so what I'd encourage you to do, is to consult your veterinary clinic about it. And I'll talk in a moment about the role of the veterinary clinic in the weight loss plan, because I do believe they have a key role there. So the first thing, we've got identification. We've identified the cat. It's important if you yourself have an overweight cat, or the vet is encountering and treating an overweight cat, that they test for any associated illnesses. So I've mentioned the what we call comorbidity, so the other diseases that can be present. We need to be aware of them so we know where we're starting from. And so things like urine testing can be very useful there. Free cat urine samples that you can collect at home with special litter that doesn't absorb the wee, that's very important, because that will instantly tell us if the cat is diabetic or not. Blood pressure measurement in older cats. So there are a lot of general health checks that really should be performed. And then, which I'm going to move on to talk about, we need support from the veterinary clinic, and weight management programs and weight management clinics, and support from a friendly and helpful and knowledgeable nurse really does make all the difference. And then I would say there isn't a magic wand, a magic diet that's going to make all the difference. I think we call this a multimodal approach, so approaching it from different angles. Yes, clearly diet is involved, but also their lifestyle and their exercise. And combined with that is the support and follow-up, because just like people, cats, when they've lost weight, they are prone to putting it back on again. And there are studies that show that a certain proportion of these cats will gain weight again afterwards, the same with dogs. So we need to avoid that with some follow-up. And how do we approach the dietary management? Well, I often will start with a food diary, which is where I ask people to really record anything that passes the cat's lips. And sometimes that's a bit of an eye-opener for the clients themselves. It allows us to really calculate how many calories they are having at the moment. Trigger points, trigger times. Where's the cat hassle you when you've got home from school and work? And that's when you tend to throw down the dreamies. Do they have some human food? And it's also important to record in this diary where and when it's provided, so we can catch those habits and where the cat is eating and how it's being fed, because that can be important. And this is a brilliant picture of a feline specialist colleague of mine, cat, who was a devil for jumping on the sides and licking the butter and the marmite off the trays. And you think, well, that's not many, that's just a lick of butter. That lick of butter, having even if it's just got 10 calories in it, for you and me is not a huge amount, but for a cat, proportionately, that is a lot. So it doesn't take much to go over, unfortunately, depressingly similar to our situation. You don't have to eat too much chocolate to go over your sort of daily calorie allowance. Once we've sort of worked out how much they're eating and any problem areas, we can then think about this concept of ideal and target weights. And these go in and out of fashion with regard weight management. And he used to sort of think that the weight they were around maturity at a year of age was their ideal weight. And then we decide on kind of some target weights. Often it's very unrealistic to aim for this kind of weight. And we know that just a small weight loss, even 10 or 20% of body weight loss, will make a difference to health. And so I think we need to be realistic and find these sort of target weights that are less daunting for everyone involved, really. And a couple of important factors in cats. Weight loss, it should be and must be slow. If it isn't slow, if cats have rapid weight loss, they can develop a lot of health problems as a result. You can starve a dog. I always say you can starve a dog without it causing any problems. If you starve a cat, they can develop conditions such as hepatic lipidosis, which can be very serious and even fatal in some cases. So dramatic cuts in calories and any periods of starvation are to be avoided. And in fact, even in sick cats, if they haven't eaten for more, we say if they haven't eaten what they should for more than 3 days, then they should have some assisted feeding. And so the same for these cats that we want them to lose weight. We don't want them to be starved and be very deficient in calories. And as I mentioned, even these small changes can make a big difference. And it's just like us, again, it's not giving up and it's, sticking with it, because it is slow and frustrating. And again, I don't know about anyone listening, if I'm on a diet and I've been on a diet for 2 days, I sort of think, well, how come I'm not, super slim already? We are all a little unrealistic. And that's why perhaps setting these interim targets can be useful. Then we need to choose a type of food, and this can be a controversial point, but it's generally accepted now in cats that a high protein and low carbohydrate diet is probably the best choice. And these type of diets also manage diabetes, so they're also in diabetic diets tend to have this formulation. Historically, and they are still available, are some high fiber diets to try and improve sort of the feeling of fullness by putting a lot of fiber in the diet, but cats don't, in general, that does reduce the palatability for cats. Now, if an expensive prescription diet is not possible, then simply changing to wet food will make a difference. So weight by weight, wet food will have less calories in it than dry food. And some people will find quite a success by just simply changing to wet food. What we should avoid probably is simply cutting down the volume of a normal complete diet, because we may make that diet deficient. And hence why the prescription diets are there, really, because they contain everything the cat needs, but with fewer calories. So it's something I'm not a particular advocate of certain diets. All food companies produce their own diets and put in a lot of research into weight loss diets. As I say, simply wet food, and there's not a magic cure. So a lot of it is about weighing the food and working out how much the cat should be fed. Now, weighing the food is something that a lot of us don't do. We just pour some in the bowl. And I, again, do this. Measuring it with cups is probably not enough either. So the standard, cups that we see that come with a lot of bags of cat food, dog food. And there's a lovely study showing the difference that some people's definition of a cup is very different from another person. So, for example, if a dog or cat is on half a cup, is that flat on the top? Is that, sort of rounded on the top? There's quite a lot of difference there and a lot of ambiguity. And in fact, you can very easily overfeed cats and dogs by measuring in that way. So weighing the food is really, really important. And in very obese cats, this is, as I said to you, we don't want to cut their calories dramatically because we may cause health problems. We don't want them to be starved. And so we really have to do some maths. And so that's a take-home message, I think, is about weighing food. And then we can use various calculations. This is what your veterinary clinic can help you with. We can use these calculations in order to work out how many calories we should be, feeding our cats. And we need to feed then a percentage of that. So we need to feed 60 to 70% of that amount. Sometimes that in itself can be too much food, and we need to step it down step it down gradually, because if they're being severely overfed, that can be too much of a restriction. And we must include treats. Treats have a lot of calories, and so if people must use treats, then we would encourage them to use a kibble as a treat, so a kibble that's from their calculated daily allowance. I've mentioned this already, so just to emphasize that point of using weight management diets. Oh, I went backwards. So the other thing to think about is how the food is being provided. I mentioned that normal cats in the wild would be hunting 20 times a day. Let's make them work for their food, and that really encourages some energy expenditure, not to mention dealing with a lot of behavioural problems. Absolutely obligatory for indoor cats. And there are various ways to do this. This is a homemade puzzle feeder. I think you can imagine it didn't cost very much money. You can get treat balls, and you can just hide bits of their food all around the house. And really there is a move with the behaviourists these days that we should do this routinely. So they should have all of their daily food via puzzle feeders. Timed feeders can also help and prevent sort of key points where the cats are hassling you. And I've got a few other examples here. Here's a commercially available puzzle feeder, a treat ball. This is another one that can be used for wet food. They have to scoop out of the middle there. And here's another one with some dry food in. So some of them can be used for wet food and dry food. Introduce it slowly. And there is also a brilliant resource on the International Cat Care website if you search International Cat Care and puzzle feeders. And then you'll find a whole load of information, including a load of homemade puzzle feeders. So again, more than just the toilet roll ones. So puzzle feeding is something I would encourage you to have a think about. Activity is the next one. Even a little bit of activity, even for an old chubby cat or a cat with arthritis, can really help. They love the fishing toys. This is a cat outside, swinging a fishing toy. It needn't be expensive. Ping pong balls in the bath. Now, some of your older cats that haven't played for a long time will find this a little bit of a shock to the system, but there aren't that many that can resist a fishing toy being waved on them. I mentioned before that how important support from the veterinary practice is, and I accompany it with a little shocking picture there to emphasise the point. And my colleague of mine in Australia, weight loss is difficult. I mentioned that it's slow and it's frustrating, and it's been proven in humans that if you have support, you're more likely to be successful. And so use your veterinary clinic, and I would encourage you to use it. If your veterinary clinic doesn't run weight loss clinics, if they don't have an interest in that, I would suggest you need to find a different veterinary clinic. And I would always encourage you to find a cat-friendly clinic. And this is if you haven't heard of this, it's a scheme run by International Cat Care where we assess clinics for how well they handle cats and with fear-free handling. And so our cat-friendly clinics should be running nursing clinics, and particularly on weight loss. So if they're not interested, find a cat-friendly clinic. Okay. What the clinic can do for you is really checking that the weight loss is not too rapid, because we don't want them to lose more than about 1% a week. And then if things are not working, they can help you identify where the problem is. They'll also have an eye on the health problems and, as I say, provide this support and encouragement. So to finish, I just want to show a sort of case study here, and then we'll finish. I'm very happy to answer any questions. This is a cat called Boo, who lives in a multi-cat household, the classic, with a very skinny cat. So fat cat, skinny cat, the classic combination. Access to the outdoors, but prefers to adopt this position in general, and is seen in this position the majority of the time. Busy owners are always out all day at work, and the cat's fed an ad-lib dry food. Presented for routine vaccination, and you can see had a weight and body condition score recorded, and this is actually not a particularly big cat, so a big weight for a little cat. So what are the problems here? A greedy cat. She eats everything. The owners are out for long periods of time. They can't feed her 20 times a day an actual mouse, or a mouse-sized meal. And the skinny cat pretty much is bullied by this cat. She sort of boshes him out the way in order to eat his food. How do we get around this? We need to restrict the calorie intake. We know that. We need to work out how much the cat's eating and how much they should be eating, and we need to weigh the portions out. We could use a timed feeder to provide another portion of food in the middle of the day And puzzle feeding, I think, would be very successful for this type of cat. And can we sneak the thin cat away and give them an extra meal? You can also get microchip cat feeders now, and I don't know if you've seen these, a bit like the microchip cat flaps. You can get microchip cat feeders, and so that you don't have to put a new microchip in. It works on their own existing microchip, and they can access only the food that they are allowed. That can cause a bit of frustration for your greedy cat, but it's something to consider. So we did some maths, work out her ideal body weight, which she's a way away from. And we literally do some maths here, and we feed the 70%, choose a Royal Canin obesity diet. So I'm not plugging any diets. They all veterinary practices will have their own preferences. And fed in 2 meals. I would argue in reviewing this that having a timed feeder and feeding it in more meals may be more useful. And setting an interim target that we work out how long it should take. The cats need to be separated at feeding time, and the older cat, there's several cats in this household, and the older cat can be kind of shut in a separate area, because that cat likes to eat ad lib, a treat ball, and then some playing each day with a fishing toy. Cats do adjust to portion feeding quite rapidly. Even when they've been used to ad lib feeding, they can adjust to it. They're more flexible than perhaps we sometimes give them credit for. As I say, the majority of cats do like playing, and she lost 1 kilo, but again, we'll have to reset our goals, and it take a little bit longer. And she doesn't reach a perfect weight, but I think you can agree that it's a lot better than it was, and looking much slimmer in that photo. And I include this cat because I have a minor confession to make, that she's my cat. And so she is my cat, who I will tell you eats sandwiches, eats melon, eats anything that these small children drop on the floor. She's the Labrador of cat form. And if I can get some weight off her, then I'm sure you can. Okay, thank you very much. I'm very happy to answer any questions about fat cats.
Thank you very much for that, Samantha. That was fantastic. And as a cat owner, as a 13-year-old cat, she says her appetite seems to have increased with age recently, and it is a constant challenge. And I'm surprised those listening haven't heard her walking around meowing quite wildly at us, because it's getting towards her tea time, but not quite. And she starts to give you a big mouthful just coming up to that. And I can see someone's actually put on there about the behaviour of their cat in terms of being quite food obsessed. So I'll come to that question in a minute. Yeah. The point you made about the microchip feeders is quite interesting, because we've also got a Labradoodle as well. And as you say, your cat's the Labrador of cats for food, and my dog is that typical Labrador, and you can hear, because she's getting old now, we can't put the food up high. But she needs to access it, and the next thing we go up to bed, and all you hear is the dog scoffing it. So I think that microchip would be an ideal solution to that. So I'm definitely going to have a look into that myself, because I think that would be a good way of doing that, or to help Bella the cat to access her food. Just as a point, everyone, please do put your questions in. We'll come to them. I have in the chat box put in the links for icatcare.org, which is the International Cat Care website, and I've also put in the link for the catfriendlyclinic.org as well. So I'm sure you're all aware of that already, but it is there in the chat box for you to access as well. So I'll do that while you were doing your presentation, Samantha.
Thank you. That's fantastic. Yeah, and as I say, that puzzle feeder resource is on that website if you just put that into the search box. But there's also quite a lot of information about obesity and fat cats, and loads of other cat diseases on that website. So yes, thank you. That's brilliant.
No problem. The first one is from a lady called Kirsten. She took on a rescue cat who's unneutered stray before. It's obviously stray and has made him very insecure about food, and while he's at the shelter, he'd regularly steal food and hide it in his bed. He's been with Kirsten for 4 years now, but he's still very keen, and will pester her for food, even when he's just been fed. Claws, swats, and gently bites her to get more food, even though he's eaten very recently. Yeah. Although he has regular meal times of wet food, with dry food always available in 2 activity feeders and scattered on shelves, climbing towers, etc. Apart from his food obsession, he's a happy, contented, cuddly boy. What else can Kirsten do to reduce his food aggression stroke assertiveness? Distracting him with toys or brushes just doesn't seem to work. So sounds like she's done
I was going to say, yeah.
You've already suggested there, but is there any other little hints or tricks that you, and I suppose it's that whole thing about the changing the behavior, is it? Is that the sort of the
I think there's actually some evidence. It's quite interesting. There's actually some evidence now that if kittens are basically, if the mum is starving in pregnancy, if the mum has a deficient diet in pregnancy, or if the kittens are born into a situation of where there isn't enough food, it actually switches on and off genes. It has that much impact, called epigenetics, where it sort of changes their genetics. And so some of these animal, poor things, are programmed almost to be hungry, because you can imagine in the wild that would be useful if your pursuit is food. And so you wonder with this chap, if we don't know the background of him, if he's a stray, it's quite likely he's come from an environment where there probably wasn't enough food. And I mean, it sounds like Kirsten's done a lot of the things that I would recommend. And I think puzzle feeding does often help these cats because it makes them work, and they've got to spend more time thinking about doing that. And so is there any way she can up that, and give him almost all of his food via activity feeders? And then the other thing I would think about, and it's a shameless plug really, but I'm not on commission to it, is there's a brilliant book called The Trainable Cat, and it's by John Bradshaw and Sarah Ellis. You can get it from Amazon. And I work with Sarah Ellis at International Cat Care, but that's not the reason I plugged the book. It's all about training cats, and your cat sounds like quite a bright cat as well, and so you can sometimes change some of that behavior that's very demanding of food and change it into other behaviors through training. And cats are trainable just like dogs. They have a shorter attention span. They're a bit like toddlers. They sort of only pay attention for a little while, but they are very trainable. You can train them to come when they're called. You can train them to do various things. I'm not saying we train your cat that's hungry to do tricks and things, but something like, I would recommend that book, because it will give you some ideas of how to divert that behavior into some other more desirable behaviors. Now, it sounds like Kirsten knows what she's doing. You've got to ignore the undesirable behavior and then reward the positive behavior. So when he is not hassling and jumping on the sides or looking for food, then he gets a treat, and you can use his food motivation to do some training things. So yeah, I would have a look at that book and see how you can divert him and use that desire for food for good rather than for bad.
No problem. I have just Googled that while you were talking. I've put the link in the chat box, and I have, just to cover myself, put other book retailers are available.
Yes, they definitely are. Yes, this is quite a recent publication, and John Bradshaw and Sarah's may be familiar to you. So they were on the BBC One Secret Life of Cats.
Okay.
So some people may have sort of come across them there, and they sort of condensed a lot of that information in a book. And so
Fantastic.
Yes, other cat behavior texts are available, definitely.
Yeah, no worries. As I say, I've put a link to the Amazon where it is, so people can have a look at that as well. I've got a lady here saying she's struggling to find alternative to Royal Canin, moderate calorie gastrointestinal wet food, because the cat's getting a bit bored of it. Is there any sort of alternatives that will provide the same sort of results, but obviously give the cat a bit more choice?
Well, I think it's all about working out how much they need. If they're feeding that as a dry food, then wet food always has less calories in it. So if you can work out the calories that's in the wet food, you can remove a portion of that food and add in some wet food to give a bit of variety. But in fact, Royal Canin have quite a range of different diets. In fact, I don't know how they manage to stock them. There's all different types of diet, but I mean, there are other companies that make probably comparable calorie restricted diets. Purina do, Hills do. So it may be worth having a look. And some cats do like a rotation of food. Other cats are very funny, they only like one type of food. But there are some cats who like a rotation. So I think those other companies are all good quality diets, and so you could certainly have a look at them. But whether you can introduce a little bit of wet food as well for interest, and just be aware of the volumes, just be aware of the amounts that you're feeding, and you'll have to cut down on one if you're going to introduce something else.
Fantastic. You mentioned about Boo, the ideal weight was 5 kilograms. Lady Veronica here is asking, how does she know what the ideal weight of her cat is in kilograms? Is 5 kilograms sort of a guide weight for cats, or is it like us humans where our ideal guide weights vary depending on our sort of physiology?
I think it does vary. I mean, there is an average, an average cat, and we often talk about the average cat in veterinary terms of being 5 kilos. But I mean, I see a lot of cats, and we get cats that are 3 kilos, and they're quite, they're fine. And then I get a cat that's a generous, as I say, a Maine Cooney, a Maine Coon would be positively skinny at 5 kilos. And that's where the body condition scoring can be really quite useful, because that will help give you a guide. So if you just have a look at some of those body condition score charts and then have a feel of your cat and see if you can work out for yourself, which is quite straightforward as to where they might be on that body condition score. And that will give you an idea of how overweight they are. So obviously if they're 20% overweight, if they're really getting up there, and you can work out their ideal weight from that. And the other thing is to ask your vet, or to even ask your vet nurse. Vet nurses are fantastic at these things because they will have more of an idea, because they see a lot of cats and they weigh a lot of cats. So, hopefully they can help you. And as I said to you, if you raise that with a nurse at your clinic, could you help me decide what the ideal weight is for my cat? If they do not show interest and offer you an appointment and ask you to come in and discuss it, then I would change clinics, and you need to find a cat-friendly clinic with a motivated nurse who's going to help you with that. So they will help you with it, but have a feel and have a look at some of those body condition score guides. So no, 5 kilos suited this cat, but it may not, that may be overweight for another. I saw a cat this week that was 2.9 kilos, but actually in reasonable body conditions. So clearly 5 would be very overweight for that cat. So, and they're, percentage body weight, 500 grams to them is what 2 stone is to some of our, they're quite small weights that make a big difference. So I would use your local, use your vets for that as well.
No problem. For those who, if you want to see the body condition score, this webinar is being recorded and will be available afterwards. So you can revisit this webinar, go back, and you can have a look at the body condition score slide that Samantha's put together, just to give you that idea about, in terms of how to look for those characteristics in terms of the palpable pelvic bones, spine, and also in terms of looking for the weight, the obvious waist as well.
Yeah, I'd also recommend if you Google the WSAVA, so the World, I can't remember what the abbreviation is, Veterinary Association. If you just type in WSAVA and body condition scoring, they have some guides as well on there with some extra information.
Is that the Small Animal Veterinary Association?
Yes. Yes, the World Small Animal Veterinary Association. Thank you.
No problem. I was like, add that or South Africa, one or the other. What about, here's one. What about a cat that is on a reduced diet but likes to self-supplement with up to 8 mice a day?
Yes, this is a problem, and this is a significant problem for some people, and it's very hard to stop cats hunting. And people will talk about using bells on their collars. In my experience, it just makes them better hunters. It makes them more patient, because they know that if they move, they'll be heard, so they sit still for hours with patience. They're always one step ahead of us cats. So I think that can be very difficult. Keeping them in at dawn and dusk can be helpful. Keeping them in overnight if there are particular times that they hunt more than others. Some cats, you have to reduce the corresponding amount of food you're feeding them in the house, which sounds awful, but it is very difficult to avoid them hunting if they are that type of cat, and so therefore if they are feeding themselves. But the other thing is trying to satisfy some of that hunting instinct at home. So that's where the treat balls and the puzzle feeders can help, because it's essentially keeping them kind of doing that instead of seeking their thrills outside and hunting, as well as mimicking hunting in play with these type of cats that have very strong hunting drives. So making sure they've got toys, and you're using fishing toys and things like that. And sometimes that will mean they don't go looking for it quite so much. So there isn't an easy answer to that, but certainly trying to satisfy some of that within the home. And so those cats, I would say, yes, scatter feeding and making them really work for their food. There's a system called the no bowl feeding system, and that is something that's coming in, whether we should actually even have bowls. Should we ban the bowl? This is one of the other buzzwords, ban the bowl, and just feed them, so that cat, instead of going looking for mice, is going looking for the one biscuit that's hidden up the stairs. Do you know what I mean?
Yeah. So that is a point that someone else has raised, that any views on no bowl feeding. So
yeah, I think it suits some cats. I don't think it suits all cats. We had some to try, and one of my cats just honestly just thought I was mad. He just couldn't understand it. Just thought I was bonkers. He just couldn't understand it at all. That was an older cat, so whether it would work better with a younger cat with a stronger hunting drive. But yes, I mean, the theory is the same. They're not sat just eating from a bowl, they're working from it. So anyone who's not familiar with it, these no bowl feeding systems, there are a couple available, but they're essentially treat balls. They're like puzzle feeders, but in little treat balls, and you give them all of their food in this method. I think one of the issues is that you can't generally use wet food in those, and I do tend to prefer wet food for some medical conditions and for some older cats. So not for all of them, but yes, I think that the concept is something we should. It's a bit extreme the other way, and there's probably something in the middle that might work for the majority of people.
Fantastic, thank you very much for that. Just anything. Yeah, so a lot, people putting in their suggestions around how to keep the cats active, using the laser toys, homemade catnip mice as well are pretty good for getting the cats moving too. So there's a few people putting in the Q&A box there, a couple of ideas and what's worked for them and how they've got that moving as well, which is good.
I would just be a little bit wary of laser pointers, I would say to people. There's a thought that they might actually make them quite frustrated. So frustration is quite a strong emotion in some cats. And so because they don't get anything from it.
Right,
so if they're chasing a fishing toy, they catch the toy, but with the laser pointer. So just watch. Some cats are fine with it, but other cats, if you think they look sort of agitated, and I've even had a case where, a cat was playing with a laser pointer, and when it couldn't get the end, it used to just beat up the other cats, like in sort of, like, I can't get it, I'll just punch you in the face instead, So, just that's my only kind of proviso with the, no to caution.
Because there's no reward at the end of it, sort of thing.
Yes, there's nothing to have in their paws. They don't catch anything. So some cats find that intensely frustrating.
Fantastic. Well, as I say, I think we've pretty covered all those points. There's quite a few other bits and pieces in there, but it's all once again about calorie control, different types of food. So I think, overall we've covered those main points, which is fantastic. So I think, we've also had quite a few people saying brilliant, thank you very much, thanks for the information, great presentation. So thank you very much for that, Samantha. I think it's been really useful, and there's a lot of good tips there. As I said, if you did miss the start of it for any reason, or there's any bits that you would like to revisit, this presentation will be available within the next 48 hours for you to access and watch as many times you want and pick up those tips again. So please do revisit and use this as a resource to support your own cats and their development, etc. So as I say, this is we do deliver these webinars in association with Feline Friends, which is a great charity, does some fantastic work and research for the felines. We are putting on a number of more of these webinars, so please do keep an eye out, and we look forward to welcoming you to a webinar in the future. So thank you very much, and once again, thank you to yourself, Samantha.
Thank you very much. Thank you for everyone listening, and thank you again to Feline Friends.
Good night.
Night.